The BA.2 variant is one of the sublineages or sisters of the original Omicron variant. The WHO reported increasing BA.2 infections in Denmark, India, and the UK in January. But is BA.2 a variant that we need to be worried? The subvariant BA.2 is also called stealth Omicron because it has mutations that makes it harder to tell from the Delta variant using PCR tests than the original Omicron variant. Now BA.2 has been seen in more than 70 countries. Nearly every state in the US has also reported BA.2 cases. Let's find out what we have learned about this sister lineage, how or if BA.2 will affect the end phase of the pandemic. I'm Dr. Han and welcome to my classroom. First, transmissibility. We now have more data showing that the BA.2 subvariant is more transmissible than the original Omicron BA.1 variant. A Danish study showed that BA.2 may be up to 30% more transmissible than the BA.1 in January. A recent study found the global reproductive rate of BA.2 had an RT of 1.4 compared to BA.1, which had an RT of 1.1. This means 100 people with BA.2 would infect another 140 people compared to 100 people with BA.1 would infect with another 110 people. Now in England, secondary attack rates in households are also higher. 13.4% of BA.2 cases transmitted within their household versus 10.3% of BA.1. Together, this means that BA.2 will outcompete its sister BA.1 and dominate the world very soon. What about immunity escape? In a recent lab study, immune escape from the Moderna vaccine, AstraZeneca vaccine, and other monoclonal antibodies treatments was similar for BA.2 compared to BA.1. In the real world, there is more evidence to support that the primary series vaccines are not effective against symptomatic disease after 25 weeks. The boosters appear to continue to work against BA.2 just like the BA.1. Protection against infection wanes over time. The Danish study found that vaccination helped protect against transmission more for BA.2 than BA.1. What about natural immunity? A different Danish preprint found that BA.2 reinfection can happen shortly after BA.1 infection, but they are rare. In a total of 187 reinfection cases, the study found 47 cases of BA.2 reinfection shortly after a BA.1 infection. The average age of the 47 cases were 15 years old, and they were all under 38 when they were first infected with BA.1. 42 cases, or 89%, were not vaccinated. 3 cases, or 6%, had the 2-dose primary series, and 2 cases had only 1 dose. These were all mild cases without hospitalizations. In terms of severity, there are mixed messages as to whether BA.2 causes more severe disease than BA.1. A recent animal study in Japan found that BA.2 is more severe in hamster. A real-world study in South Africa found something different. Between December 5th, 2021 to January 29th, 2022, BA.2 infections increased from 3% to 80% of the total cases. The BA.2 had a similar risk of hospitalization as BA.1. BA.2 also did not appear to cause more severe disease than BA.1. Because hamsters are not small humans, the real-world data from South Africa is a stronger piece of evidence. I'm more confident that BA.2 is not more severe than BA.1, and hopefully we will soon see more confirmation study coming out from other countries. To sum up, it appears BA.2 is prolonging the Omicron wave. Many countries like South Africa did see the tail extended a little, but BA.2 doesn't seem to making a second surge. This is good news for all of us. This channel is about health topics that is beyond just the pandemic. If you would like to follow for more content, please consider subscribing to the channel, and thank you for all of your support. And like always, please stay safe, stay healthy, and take care. Bye.